When your legs don't work like they used to before, and I can't sweep you off of your feet.
Disclaimer. These are just simplified discussions only by Echo. It is to provide general ideas or instructions for conditions that have already been diagnosed by a qualified medical provider. The content is not intended to be a substitute for professional medical advice. The information in this video is by no means complete and does not apply to all conditions, especially if you have other health-related issues. May God be with you all.
Amputations are done urgently and electively to reduce pain, provide independence, and restore functions. It is done in order to preserve functional length, preservation of useful sensibility, prevention of symptomatic neuromas, prevention of adjacent joint contractures, early prosthetic fitting, and early return of patient to work and recreation. Amputations may be indicated due to the following. These are the absolute indications: irreversible ischemia in a diseased or traumatized limb in which there is already a dead or dying tissue; vascular disease, which is the most common reason for a lower extremity amputation; peripheral vascular disease. Peripheral arterial disease is a complication of diabetes that happens when blood vessels in the legs become blocked or narrowed due to fat deposits. The result is reduced blood flow to the feet and legs. Burns due to thermal or electrical injuries, and frostbites. Relative indications are the following: infection such as gangrene, osteomyelitis, and tropic ulcer; malignant tumor like osteogenic sarcoma; trauma or crash injury, which is the most common reason also for an upper extremity amputation; congenital anomalies, common in children because of gross malformation. Since we're talking about lower extremity amputation, if you do have diabetes mellitus, consider the following for prevention. Control your diabetes. Monitor your blood sugar daily, because people with diabetes store high sugar in the body. If uncontrolled, the diabetes causes damage to the nerves and blood vessels, and these damages can lead to a foot infection known as diabetic foot. Check your feet every day. Is there any red spots or redness that doesn't go away? Are there calluses or kalyo? Medyo alarming yan, lalo na kung natukulap na ang kalyo. Check your nails. Is it too long, thick, or ugly? So keep your toenails adequately trimmed. And keep your feet dry and moisturized. Check for any fungus between your toes or athlete's foot. Always consider the loss of sensation in foot to heat, cold, or touch. Persistent drainage of pus or blood from the unhealing wound. Do not wear tight-fitting shoes, because it is a common cause of a diabetic foot problem. So buy special socks intended for diabetic persons. It should be seamless. Get good shoes and check it every day before putting. Syempre pagka lumaan na, mas maganda paltan mo na agad, lalo na kung manipis na or hindi na ganun kaganda ang fit sa'yo. And lastly, don't go barefoot. Wag na wag ka maglalakad ng yapak pag diabetic ka. If you're already a candidate for amputation, physical therapy should be done before and after your operation in order to reduce edema, increase strength, prevention of contracture, to maximize functional independence, to improve balance and coordination, for walking training and use of assistive device, for pain management, for the so-called phantom pain, and psychoeducation for phantom limb sensation, lifestyle adjustment, and post-traumatic stress disorder. So how's my episode po? Kindly like and subscribe to my YouTube channel, comment below, or send me a message for your suggestions or critics. Thank you very much.